Good morning and welcome. You're listening live to Heart-2-Heart, a program which aims to help you understand and to become your loving self. This is KMET 1490 AM ABC News Radio. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice.
Yes, you are. And I'm Dr. Robert Jaffe. I'm also a licensed marriage and family therapist, along with my best friend, partner, confidant. I'm trying to think what else.
Is that so hard for you to say?
Confident. I'm trying to think of the words. And we're here.
My God, it's been 16 years.
It has been. It has been. That's a long
time. You still
time.
Don't have the right words.
And we are here today to share with you some of what we've learned about addictions, codependency, relationships, and trauma. And hopefully this will be both entertaining and enlightening. And we invite you to join us for the next hour. And we also invite you to share your thoughts, your experiences, and any questions you have. During the next hour, you can reach us at 951-922-3532, 951-922-3532.
Yes, and it's this weekend is Halloween weekend.
It is.
And we know that many of us, have been looking forward to the holidays. But I guess the holidays this year are going to have a different tone to them due to COVID. As much as it is, exciting to go door to door and knock at the doors and ask, do your trick or treat, but you have to be careful this year, right?
Yes, yeah. I think most people are not actually going to do it, be out, but there will be some people.
Yeah, I mean, the people that I know of, they have decided to do indoor activities for themselves. Like they have set up, pumpkin carving or making a special cookies and, doing things like that. Just very close family members, a group of, 6 to 8, so that they can, at least experience some of what needs to be experienced during, Halloween. But however you celebrate that, just be sure that safety is first. And we hope that you enjoy it regardless of COVID.
Absolutely. Absolutely. So
have you decided what to be?
Yeah, I have actually. And I've decided what to be based on our program today. What I've decided to be is my loving, authentic, true self.
Oh, you took my role. You took my role. You took my role. That's not fair. You took my role.
Yeah, my loving, authentic, true self. That's what we're going to be talking about today, because we've been talking a lot about codependency, which we have called, and we have called the most unrecognized and common form of addiction. And so we're using addiction in its broadest sense. And what we're saying that is addiction is something where you're looking outside of yourself to make yourself feel whole. And when you look outside of yourself to make yourself feel whole, what you find is something that will give you a temporary sense of pleasure, a temporary sense of relief from conscious and or unconscious emotional pain that you're carrying. So that if you take a drug, if you use alcohol, if you have a sexual relationship, or you're masturbating, or if you're gambling, and a whole host of other things, food, etc., that you temporarily get some relief from the emotional pain. And often you get a sense of euphoria, and people mistake that for happiness, but it isn't happiness. It's an altered state, and it's probably a a better feeling state than you're normally in, or you wouldn't do it. But it's not the same as true happiness, and it's not the same as being aware of the joy of living. And that's really what we're talking about, is awareness of the joy of living. John Bradshaw, one of the great pioneers in the works of dysfunctional family systems, coined the phrase "human doing." He said, "We've ceased being human. We've ceased allowing ourselves to be human beings, and we are now human doings." And so we even say in the United States, "How are you doing?" We don't usually say "How are you?" anymore. We say "How are you doing?" And then the answer is, "I'm doing fine," right? But that means that we have to be doing in order to be fine. And the truth is, we don't have to be doing. We can be just being. And what does that mean? It means experiencing the joy of being alive and the joy of oneness.
Well, it's interesting that you said that, because along the same line, when we meet somebody new, after "Hi, I'm John," "Hi, I'm, I don't know, Mary," the next thing we ask is, "What do you do?"
Mm-hmm.
Right? It is as though we are identified by what we do, right?
Yeah.
And the more prestigious titles we have, I don't know why we call them prestigious title, because everybody, loves to do something, and it doesn't mean that one is above the other one. But then again, what do you do? The more you say that you are above the average and at the highest peak of, success, the more attention you get, the more, the more demand to get to know you is there. Whereas, what we do is not who we are. What we do doesn't define who we are.
Correct. And unfortunately, that's part of what codependence is, with identification with what you do. Right. So I am what I own. That's part of the codependent reality. I am what I own. Listen to all the horses and the boats and the automobiles and the homes and the jewelry that I have, and you see how much I'm worth. Right. So I am what I own. I am what I do. I'm a doctor, I'm a lawyer, I'm an engineer, I'm a psychologist, and of course, if you're not those things, then maybe you're less than me.
You're less than me.
Right.
Yeah.
Yes, I collect garbage for a living, and oh my God, how can you do that? That's so low. as though we could survive if we didn't have garbage collectors, right?
And even among the professions such as psychotherapy, right? And depending on where you are, people even separate you in that category.
Right. It's ego, right?
It's ego, right? Yeah. For example, in the field of psychology, we have psychiatrists who are MDs, and then we have psychologists that they could be PhD psychologists, or they could be PsyD psychologists. We have, marriage and family therapists. We have social workers, clinical social workers. We have all of that. There are several other. We have case managers. We have nurses. We have all these categories. But then again, even within that, they look at you less than the one that they believe is above you.
Right.
And the reality is, everybody, takes care of one area in a given field of human relation, because, and then, contributing to human life, and one without the other one cannot function.
Yeah, and for a long time, it was thought that anyone less than a psychiatrist could not do psychotherapy. Right. So even people who were psychologists and had PhDs, they couldn't do psychotherapy.
Right.
And then for a long time, even marriage and family therapists were not allowed to use the term therapist.
Right.
We had to use the term counselor.
cancer.
Right.
Yes.
It was all ego.
Yeah. So it doesn't matter, you and I have both PhDs, right?
Right.
Which is, according to academia, is the highest rank of education globally.
Mm-hmm.
So PhD, that makes you the expert in the field that you are in, which is in this case, psychology and psychotherapy. But then again, those who become psychiatrists, they are MDs, and MDs usually are not, they don't do psychotherapy. They just do medication evaluation.
Mm-hmm.
And
but they're allowed to do psychotherapy even if they don't have training.
If they don't have, yeah, they are allowed to do that, which is, and I have seen some sample of that, which is really.
We have seen samples of
right.
that.
And
yes.
Is questionable. But then again, there are psychiatrists that, of course, we need, they do wonderful, psychiatric assessments and diagnosing. Same thing with, marriage and family therapists. So they are all allowed to do what the law of psychology, the science of psychology allows it. But then again, it is among the professionals themselves that, because of their ego functioning, that they kind of deviate what they do in a ego-based fashion, not because it is that what they do is the truth of the practice. So anyway, what I'm trying to say, is how we look at ourselves.
How we look at ourselves,
and then how we are happy with what we do.
Yes.
How brings out that ego defenses as a protective factor to keep us where we believe we need to be.
Yeah, it's about the ego, and the ego is a part of us that dates back to the amoeba, right? The amoeba, I'm sure most of you are aware, the amoeba is a single cell alive creature that is microscopic, but the amoeba is about getting. It needs to get from something outside of it in order to survive. And we, as mammals, as human beings, we need to get in order to survive, right? We need to get water, we need to get food, we need to get shelter. And if we don't have those things, we won't survive very long. So the ego is there to say, I need to get. And the ego, and of course, the ego is correct. We do need to get. And so it isn't that the ego is something bad. The ego is something that we all have. And now that we're living in a society that for many of us, our basic needs are met, the ego, not to be left out of the equation, still wants to get. And it believes that more makes it more safer and more secure. So we'll talk about that a little more after our break. Did you want to say something?
Yeah, well, I was just going to say we are at our commercial break.
We're at our commercial break, and we will talk to you in a couple of moments.
Yes.
Okay, bye-bye.
Thank you. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM, ABC News Radio. We thank you for spending your hour with us this morning. Our subject is how to get to our authentic true self as part of, codependency sections that we have been sharing with you. Our phone number is 951-922-3532. Please join us, ask your questions, or email us if you don't wish to share your question on a live program. We understand that. And also, please introduce this program to those that you believe they may benefit from it. So, Dr. Jaffe.
Yes, ma'am.
You were talking about
the ego.
The ego functioning.
The ego functioning. So what I was saying is the ego needs to get in order to survive. And what it needs to get, it decides. It decides what it thinks it needs, right? So what it actually needs is just what I said. You know, it's very simple. It's food, water, and shelter, pretty much. That's what it needs in order to survive. But once those needs are met, the ego doesn't just lie idle. The ego still continues to work and still continues to believe it needs to get. So what is the job of advertising companies? The job of advertising companies is to implant an idea in us that we need something that we don't need. Right? Because that's how they sell their merchandise. And their belief is that if they don't sell their merchandise, they will die. Right? So their ego then tries to tell our ego that we need this. We need the latest iPhone, right? You know,
yeah,
and we need the most up-to-date computer.
Yeah, I mean, where have you been all your life? You don't have this system in your iPhone. You don't have this,
yes,
camera. You don't have this shirt. You haven't had this candy before. I mean, oh my God, what a loser.
Exactly, and we need the latest medicine, and latest vitamin, and we need the most prestigious shirt, the one that's got the label on it, and we need all those things, right? And that's basically what the ego says, and then their ego hooks into our ego, and we believe it, and then we have to get it, as though if we don't get it, we won't survive. Now, we're not thinking that, right? Because we're all intelligent. We're not thinking, if I don't get this, I'll die. Although some people say that, but basically, the feeling is, I really, really need it.
Right.
Yeah, and of course, it's an illusion. We don't.
I mean, I've seen some of the commercials, like they're selling a hose. They design it in such a way that if you don't buy it, you must buy it. It is as though your life depends on buying that hose and have it in your house.
That hose, you need that hose, because if you have another kind of hose, you're wasting your money and you're going to lose a lot of money in water. And so, yeah, it's very interesting. Yeah. So that's what the ego is. The ego again says, I am what I have. I am what I do. The ego says, I am my reputation, right? So the ego says, I am what other people think of me. And that plays into codependence, because codependence is, and I've said this 1,000 times, and now I'm going to say it 1,001 times, codependence is you go to bed with somebody, and in the morning you wake up and say, good morning, how am I, right? And why do you say that? You say that because you need the other person to approve of you. And if the other person doesn't approve of you, you're not going to survive. It's about survival. And I'm going to keep saying that, because intellectually we go, no, that can't be true. But emotionally is where we live. And when we believe that, that motivates us to do all sorts of things, some of which are in our best interest, but a lot of which aren't. So what would you say, Dr. Mitra Rishadian, is the biggest issue that couples come in and deal with, and how does that relate to ego?
Oh, what do you think? I think maybe codependency.
Codependency. Right.
And what's interesting, that realistically doesn't matter what cultural background couples come in, to our offices. We see that codependency is the prime aspect, majority of the time is the prime, presenting problem, but they don't come and say, I have a codependency issue, of course.
No.
They come in with their issues like argument, fighting, disagreement, lots of hurt, lots of blaming, lots of, he's doing it, she's doing it, he's not doing it, she's not doing it. And it's just that, it's devastating. And when we bring the issues that they are related to codependency, and we point out if whatever they're doing has a base on this, and we reflect on their communication style, their jaw drops, and the first thing that I usually get, is that, oh, I'm so disagree with you. How can you say that about me? Because he's doing that to me, and you're telling me I have a part in this. What kind of a treatment are you, giving to me?
Right.
And sometimes, those reactions are so, difficult, and then but, of course, we explain it, and it's a gradual things for them to get it and to understand it. One of the things that I have come across is, and actually I got an article about it this morning too, which I haven't fully read, but it got my attention because it's very much close to my own belief that, for example, in the individualistic nations like United States, right? We send our youngsters out, let's say around the age 17, 18, 19, 20, the latest, right? And that's the pretty much, they're not ready yet. They're not mature enough for the most part in order to be able to find their way and make solid decisions for themselves, primarily because of the codependency that they have during growing up. Right. And of course they don't recognize that they have codependency, but we see that rate of, for example, drug and alcoholic abuse among individualistic nations are slightly higher than collective societies. It's because the closeness, the family bond that's there. Unless of course we're not talking about unhealthy family dynamic. We're talking primarily about healthy dynamic from family members. We see that there is a level of maturity in terms of finding direction is easier among collective cultures than it is among individualistic cultures, and also rates of alcohol and drug use. And that is very an interesting finding. It is because that family bond and the way that parental love is exposed or it's been transferred to families has a higher degree in collective societies than it has in individualistic societies. You don't see that many single parents among collective cultures, but we see it, very much higher rate in individualistic cultures. So formation of individuals, true self has, direct link to the family dynamic, right? And the level of love and the level of support, level of, nurture and nature both coming together within those dynamic has a lot to do with it. Whether you feel supported, you form a different, true self, versus if you don't feel that supported, then you form a different, true self about yourself.
Yes, absolutely.
Right.
Yeah.
And therefore, level of codependency, also falls along the same line. The more you feel supported and love, you have less codependency than if you haven't, and you develop higher level of codependency.
I agree with that. Absolutely. Yeah. So what is the true self?
Yes.
Right.
That's an umbrella question.
Yeah. And we often start off the program with talking about qualities that we come into the world with. These are universal qualities that we believe that it's hard for me to say all or nothing, but we believe pretty much all people come into the world with their authentic true self. There might be exceptions, but for the most part, we believe that most people come in open to new experiences. Most people come in curious about the world. We were born with curiosity. We believe that all people come in as sexual beings. We believe that people, when we come in, they're honest.
Right.
They have to learn how to lie. We also believe that people most people come in emotionally available, meaning that they can take in other people's emotions and share their own emotions, and therefore connect with other people on an emotional level. And we think that people also come in with the ability to be compassionate and confident. So those are all aspects of our authentic true self. And what happens then is, if we have parents, and we're lucky enough to have parents who see those aspects of ourselves and recognize that we are individuals and that we are going to express ourselves in our own unique individual way, and that they're there to observe and nurture and help us to express those qualities and our thoughts about ourselves and our thoughts about them as parents, and our thoughts about their thoughts about everything else in their life. Then their authentic true self becomes stronger, and they begin to learn that they can trust themselves, that they can make good decisions, and of course that their feelings matter, which is the feelings are our inner world. And when our inner world is seen and reflected back and nurtured, then our authentic true self develops a solidity. And that's what we call, when we say, our solid authentic true self. And so all of that takes place when the child is seen for him or herself as a unique individual, and that each unique individual comes to the world with gifts. The gifts are many and varied, right? There are artistic gifts, there are verbal gifts, there are mathematical gifts, there are musical gifts.
And our uniqueness in any possible way is a gift.
Exactly. The combination, the combination is unique to us. Yeah.
Just as our facial, feature, our body shape and sizes are different from each other. I mean, can you imagine? I mean, look at outside. We can't find two people looking alike.
So we can find them looking alike, but we can't find them looking exactly alike.
Exactly alike, yes. Yeah. And that's because each of us are unique in our own way.
Even identical twins.
Even identical twins. Mm-hmm. You're right. And then that it is that uniqueness that makes the world, interesting. I mean, if you walk into a garden of flowers, even, you don't find two red roses looking the same or smell the same. Right.
Similar.
They're similar, but they're not the same.
Right.
Right. And that differences, that uniqueness of each flower and each stem and each branch and each, leaf and each, color, that makes that garden so attractive and peaceful that you just don't want to leave it. Mm-hmm. If we can look at, the universe and the human being in such a way, then, ultimately, we look for our uniqueness, but we don't pay so much attention to our differences in a negative way and trying to make everybody look like us.
Right. So we're born into the world with this ego that needs to get. And the ego, because it's about survival, is very, very, very powerful. Now, is that all there is to a human being? Is our need to get, and our need to survive, and our need to get more and more and more? And if you ask the ego goes, of course, that's what else is there? It's just about acquiring things,
Yeah, I just made, 250 grand this year. Oh, okay, so next year I'm going to have to make it 450 grand.
Exactly.
Otherwise, I'm not making progress.
Right. And exactly. And so the ego's job is never done. As long as we have an ego, the ego will want to get. Now, but is the ego there alone inside of a human being? And the answer is an unequivocal no. What is the other side? The other side is our spirit or our soul.
Let's talk about it after.
And we're going to talk about the spirit and the soul, and we're going to talk a little more about codependency and how we can acquire a stronger, solid, authentic, true self after our break. We'll see you soon.
Welcome back from our commercial break, Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here talking about authentic true self, and we are just less than 48 hours away from Halloween 2020, right? And we do hope that you have a safe one and enjoy yourself regardless of COVID.
Exactly. And so we left off talking about the ego and the spirit, or our authentic true self. We gave you some qualities of the authentic true self. And so right now we're gonna say a little bit more about the spirit, which is the other part of us. Our spirit comes to us through our awareness that we are more than our bodies, and that awareness that we are more than our bodies comes to some of us at a very early age, and comes to some of us and during adolescence. Some of us don't recognize it until 20s, and some of us later on in life, we begin to recognize that we are more than our bodies. And some of us never do. Some of us really think that that's all we are. And so we go through our whole life believing that it's all about acquiring, and it's all about reputation, and we don't progress spiritually and emotionally. So the spirit only cares about a couple of things. The spirit only cares really about love, and about giving love, and about receiving love. And the spirit actually sees the giving of love as the receiving of love. So the spirit isn't that I'm going to give you love, and then I'm going to wait until you give me back love, and then if you don't give me back love, then I'm going to stop giving you love, because that's the ego. The ego is quid pro quo. I'm not going to give unless I get back. So it's still about me getting. The spirit doesn't care about that. The spirit wants to give love, and gets joy in the feeling of giving. And spirit recognizes that when it's open to love, the giving of love, all channels are open, and it's giving itself love when it's giving to others. So just the act of giving is satisfying to the spirit. People who are living in ego can't understand that. They say, why give to that person when that person can't give you anything back? So
well, that's exactly, one of the questions that always comes up, why do I have to be kind and loving to this person who doesn't value what I give to him or to her?
Exactly.
He's worthless. He doesn't deserve my love. He doesn't, or she doesn't deserve, my attention, or, she's not meeting my needs. He's not meeting my needs. We all hear about that.
Right. And so the answer, or at least one answer to that, is you don't have to. You don't have to. You get to choose who you bring into your world. And if it's somebody that you really feel isn't worth your time, you don't have to be with that person.
Well, I have a different take on that.
Good.
Right?
Good.
So my take is that, if you feel like a person is not meeting your needs or is not, attending to you the way that, you want it, right? There are two things are happening, and two things needs to actually happen. One is to stop blaming and having expectation of a person who's not able to meet you where you want to meet with that person, right? And accept and understand the person's ability, capability, understanding, wish and wants that they have for themselves, right? The second one is, look at yourself and see why your needs are so dependent to that individual, right?
Right.
And what is it that you're not able to satisfy your needs? Because if we expect our needs to be met by presence of others, then we are in big trouble for the rest of our lives, right? We need to have a deep understanding of our needs and why they are there, and how to work through them and how to make them, satisfied, regardless of who's in our life or is not in our life, right? In other words, we can be dependent on another one for happiness. The happiness needs to happen internally within us, and to understand what's going on with me that I'm not happy with myself or with my life. Having the expectation that somebody else is responsible to make me happy, it's a recipe for unhappiness.
So I'm going to say that I think that's absolutely accurate.
Great.
Absolutely accurate. And I'm going to add an and. Not a but an and. And the and is when we are in an intimate relationship, when we are with a partner, we are interdependent.
Interdependent. Yes. Right.
And in being interdependent, that means that there is a part of us that is dependent on the other person.
Right.
Right.
Yeah.
And so if that person, for whatever reason, cannot meet those dependency needs, and you've done your best to do what you just said,
right,
then you may have to consider not being with that person.
Right. And the point that I'm making is, what I look at is from codependency, I'm looking at independency and then interdependency, right? If that personal, individualistic independency doesn't happen, we can be interdependent.
Right. Exactly. No, and I think we're on the same page with that.
Right.
Yeah. I'm just not wanting to give the impression that because you've selected a partner that you now have to work that out with that partner. If that partner, for whatever reason, is doing things that you feel aren't conducive to continuing the relationship, and you've done your best to try to work it out.
No, yeah, we have always to do our best before we say goodbye to a partner. Absolutely. However, again, for me, independency is a key factor to happiness, whether we are in a relationship or not.
Yes.
We can have somebody else gives us emotional safety. We can have somebody else give us emotional happiness, because that means that I'm always dependent on that person for my happiness. And that's such an exhausting, expectation that we put on somebody else that's our partner.
Yeah, I think that's true. Yes, you can't solely depend on that partner.
Right.
Yeah. At the same time, you wouldn't be with that partner if they weren't giving you some sense of security.
That's the interdependency part.
Right.
Yes.
Right.
Yeah.
So going back to the ego and the spirit wants to feel loved and loving. That's what the spirit really wants. The spirit wants a loving connection with others. The spirit, and along with that, the spirit wants kindness, right? So if the person is kind, or you are and you're with that person, that kindness will enable you to access your lovingness much easier. And you accessing your own kindness will allow that person to access their own lovingness much easier. The Spirit wants kindness. The Spirit wants loving connection. And the Spirit also wants truth.
Right.
Right. So when we're with another person and we feel as though that person isn't being truthful with us, then the Spirit sort of rails against that and says, this doesn't feel right. There's
Right.
something wrong here.
Right. And we feel it. And, usually we feel that what's happening is actually there. But, we don't want to accept it. And we go into this denial, mentality that, oh, no, this is not happening.
Mm-hmm.
And then we compensate more in order to get that love. But then again, that's the cycle of codependency.
That is the cycle of codependency, absolutely. So that's what the Spirit wants. And when people come in for counseling, mostly it's because that their spirits aren't getting fulfilled, and they're locked in their egos. And the ego is about getting. So so each person is either secretly or not so secretly blaming, as you said before, the other person for what he or she is or isn't doing, and how he or she is or isn't acting. And so our role is to help them to stop blaming and to look at the part of themselves that they are not allowing themselves to move into their own spirit, right?
Exactly.
Yeah.
Yes. People sometimes have a different picture of what spirituality actually means. And I think maybe we need to say something about that. But what do we mean by spirituality?
Okay, so spirituality to me means recognizing that we are not just our bodies.
Right.
Right. And if we're not our bodies, then the question becomes, what are we? And what are we is a question that philosophers have thought about and debated about and expounded on. And if you ask that question seriously, and you do nothing else but try to answer that question, and you can meditate on it, and you can read all sorts of books on it, and you will eventually come up with your own answer. It's not an answer that someone can tell you. You have to you have to understand experientially what you are. And what we really are is energy, right? And we're not just energy like a light switch. When you turn the light on, there's a light. We're conscious energy, right? We have consciousness.
And that's exactly what I was going to say. I think that, it's that deep part of ourself that we know what the truth is. Mm-hmm. And then for a variety of reasons, we are either able to get in touch to it or not.
Yes. Right. And if you cannot get in touch with that part of yourself, then your work is to understand what the blocks are.
Right.
Because every human being comes to the world with this unique energy, which is your authentic true self.
Yes.
And without recognizing that, number one, that you have an authentic true self, and number two, that you can access that, you're always going to be caught in your ego, which is about getting.
Right.
And then it's going to be the ego basically says, I'm here, and the most important thing is me.
Right.
And nothing else really matters.
Right. So some examples of that, is I'm going to start from the very basic ones. So, I know that piece of pastry is not good for me, but I have it anyway.
Right.
Right. I know having an extra drink is not good for me, but I have it anyway.
Yes.
I know driving above the speed limit is dangerous, but I do it anyway.
Mm-hmm.
Right.
And say, why would you do it anyway?
Why would you do it anyway? So
Yeah.
that's
Yeah.
so there is this inner energy that knows what is right for us, but we disregard it for a variety of reasons.
Mm-hmm.
And those are the reasons that causes, codependency. It comes from our codependency.
Mm-hmm. Right.
Right.
Now,
I know name calling my wife or husband is not accurate. I feel bad afterwards, but I do it anyway.
Right. And why do we do it?
Yeah.
Is the question. And when you ask that question and you are really interested in discovering it, the why, then you are on the path towards acknowledging and experiencing your authentic true self.
Right.
Because asking about yourself is the most valuable question that you can ask.
There are also people that they say, oh, I said it because she deserves it or he deserves it.
Yes, and again, that's flipping it around and saying the other person causes me to whatever. The other person makes me whatever.
So which is also an aspect of codependency.
It's an aspect of codependency.
Yeah.
And it's and so what I think goes on a lot, and you can tell me if you believe this or not. Yeah, I think what goes on a lot is that people choose to avoid pain.
Yes.
Rather than deal with the fact that they are incorrect or wrong.
And let's stay with that, because I think that's a good starting point for our next time.
Avoiding of pain rather than dealing with the truth.
With the truth. So happy Halloween to all of you. Enjoy yourself, and we look forward to seeing you again next Thursday at 3 o'clock for another episode of Human Sexuality, and the following Friday for exactly the topic we just talked about, right?
Exactly the topic we just talked about.
Right. Happy Halloween. Be safe. And don't forget, all you need is love.
All you need is love, and we wish you happiness, health, love, and safety. Okay. Bye-bye.
Bye-bye.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily